Hey, so welcome everyone to our Career Pathways virtual program for the month of November. Thanks so much for joining. We're going to get right into it and introduce our speakers this morning that are going to be discussing careers in ultrasound and using ultrasound technology. So welcoming Carrie and Abigail, I'll turn it over to both of you to introduce yourself and take it from here.
Great. Well, I'm Carrie. I am the lead stenographer at ProHealth Care for the general department. I have Abigail here with me. She is the supervisor. We're going to just be discussing general ultrasound today. Oh, there we go. All right, so a little bit about myself. I went to UW-Milwaukee. I got my bachelor's degree in the ultrasound program there. I've been with ProHealth for 7 years, and then for the past year and a half, I've now been the lead stenographer for the department.
And I'm Abigail. I'm a supervisor over here at ProHealth. I got my degree over at Carroll University with a bachelor's in health science, and then did my ultrasound program through Aurora St. Luke's. I started my career out at Children's, Wisconsin, and I was there for 5 years before I became lead stenographer over there. I was there for 2 years in that role, and then came over to ProHealth, and have been here for about a year and a half. I personally chose ultrasound because I had many healthcare experiences as a patient, and I had many places I did not want to go to. And when I had my first ultrasound, it was my first experience that was not anxiety-ridden. It was a nice, calm environment, a dark room. The stenographer that was doing my exam was very kind and nice and gentle, and that was kind of where my start of it occurred.
And then I guess I should say why I chose ultrasound. I've always been interested in health science, anatomy, physiology. In high school, I really just thought the human body was really interesting. I was originally going for nursing and realized that was not my career path, and came across ultrasound, and I just fell in love with it. All right, so what is ultrasound? Ultrasound uses sound waves to produce pictures of the inside of the body. Ultrasound is safe and painless. It uses a small transducer and ultrasound gel. It's placed directly on the skin, and we just kind of move it around, get some pictures. It's non-invasive imaging test that does not use radiation. The images are taken in real time and can show the structures and the movement of the internal organs. And then this helps, this allows ultrasound to look at, blood flowing through blood vessels. All right, so some skills that are needed to become a stenographer. The big thing is, interpersonal skills, communication. We're, constantly talking with patients, with doctors. You need to have a kind of real professionalism, be able to communicate well with your peers. Also, another main thing is attention to detail. Ultrasound is, live scanning. It's dependent on the user, so we need to know normal, abnormal, different, shades of gray represent different types of pathologies that could be important. If you miss something on your ultrasound and the radiologist isn't aware of it, they will not comment on it. So it's really user dependent. You really have to be great attention to detail. Critical thinking also is a big thing. Before we get each patient, we kind of do a little background history. Why are they coming here? What labs are elevated, or other tests that they might have had done? We kind of piece this all together and get a good patient history from the patient. And then while we're scanning, we're constantly thinking, okay, what would this be? What am I going to be seeing today on this ultrasound? So, constantly thinking, you need to know your normals, abnormals, which is everything that they teach you in school. Yeah. All right, so education, there's kind of two ways to do this. You can get your bachelor's degree, which me and Abigail, we both have, and there's also an associate's degree. So with your bachelor's degree, you apply to the college. You have to do 2 years of just their general credits. A lot of the times the ultrasound program kind of tells you what classes you need to take, and then you apply to the ultrasound program. The ultrasound program is 2 years. So usually like your second year of college, like in the fall, you apply to the program. Also, when applying, a lot of times there's a requirement that you need to shadow in ultrasound. So you kind of go to some hospitals around the area, shadow in the department, kind of see what ultrasound is about. And also, a lot of the programs do require that you have CNA hours. So that is becoming a certified nursing assistant. And that just kind of helps with, patient care. You kind of get a feel of how, caring for patients. So they kind of want to see like how you interact with patients. And then also for an associate's degree, it's a smaller amount of time. You still do have to take prerequisites for that program. Sometimes it's not like 2 years. It just kind of depends on what their program wants you to do. And then you would apply to their ultrasound program, and typically those are also kind of like a 2-year program as well once you get in. And those also require that you become a nursing assistant as well. So once you decide, you want to be a sonographer, there's 2 other ways to go about it as well. There's general ultrasound, which is what I and Abigail are, and then there is also cardiac vascular ultrasound. So general ultrasound, we do abdominal scans, pelvic scans, pediatrics, vascular. We look at muscles, tendons, pretty much everything in the body except for heart, which is then what a cardiac sonographer would do. So you kind of have to decide which way you want to go. So that's where the shadowing really comes into play. That usually you have to shadow with an echo department and with a general ultrasound department, and then that way you can kind of get a feel, where do you kind of fit. Yeah. All right, so here we have listed some of the schools around the area. Black Hawk Technical College, that's where you get your associate's degree. There's Carroll, Concordia, UW-Milwaukee, and then Edgewood, which is kind of out in the Madison area. But here is just some schools where you can go and apply or, come out with your ultrasound degree.
And in this, it also shows all the different ultrasound schools as well in the area. So, the 4 major ones are the bachelor's degrees and where you could obtain that. But the big ultrasound schools in the area are Black Hawk Tech, Aurora St. Luke's, and then the UW hospital clinics. And then Concordia is a little different. Concordia University has a general diagnostic medical sonography program. So they have their own set of clinical sites, and they keep everyone in-house versus Aurora and UW. You go to a different location. So from Carroll, I was at Carroll for 2 years, and then I went to Milwaukee, and I was in Aurora in their school district, traveling all over our lovely state of Wisconsin for clinicals. And then UW is now through Freighter or Madison's program. So you have, different locations you could potentially be. Concordia and Black Hawk Tech would be the only ones that you remain at the same place you were the whole time. The other schools require you to kind of shift and do your 2 years at a different location.
Day in the life of a sonographer. So our main responsibility as a sonographer is that we acquire and analyze sonographic images to assist physicians in diagnosing and treating medical conditions. All right. So a typical schedule, there is hospital-based and clinic-based. Hospital-based is usually staffed 24/7, so that's including, holidays, weekends, nights, PMs, AMs, everything. Clinic-based, you usually have about set hours during the weekdays, and they are usually closed on holidays and weekends. So kind of, figure out which route you want to go with that as well. Here at ProHealth at our main hospital, which is Waukesha Memorial Hospital, we have a few different options. For the most of us, we work 10 hours every day. We also have a 770 program, which is really nice. You work 7 days in a row, you get 7 days off. There is also a second shift that works until 9 o'clock at night. And then we have a night shift who is 9 o'clock at night till 7 in the morning. So around the clock care at Waukesha Memorial Hospital. Our smaller hospitals, which are Oconomowoc Memorial Hospital and McWanago Hospital, we are staffed during the week for 10 hours, and then we work until 5 o'clock, and then somebody is still covering, they call it call, so you're on call from 5 o'clock at night till 7 in the morning, and that's just, if any ERs come through. And then same with the weekends and holidays. We're not in-house that entire time, but we are on call in case we are needed. All right, so this is our equipment. Here at ProHealth, we have the GE Logic E10. There are multiple different brands of ultrasound machines, all kind of pretty much do the same thing. Some, machines are better for like cardiac or obstetrics. This is just the one that we went with. We love our GEs. Also, there's this fun word in ultrasound called knobology, which is knowing all the buttons and functions of the ultrasound machine. Like from the picture, you can see there are many, many buttons on there. Each one does something differently. So it's kind of getting to know the machine and, the functions that we need it to do. All right, so types of ultrasound exams. So this is mainly for general, which is my department. We do abdominal, obstetrics, pelvic, small parts, and venous. For abdominal, reasons for exams, like why somebody would come to us is like abdominal pain, gallbladder concerns, or elevated labs. And then what we're imaging is the liver, gallbladder, pancreas, kidneys, spleen, bladder, aorta, IVC, and the vessels of the liver. For obstetrics, reasons why someone might come to us is to evaluate pregnancy, confirm a pregnancy, rule out abnormalities within the pregnancy. What we're looking at is mother's uterus and ovaries, and then we're looking at the fetus and all of the organs within inside the fetus, and then also the placenta and cervix of mother. For a pelvic ultrasound, a lot of times patients are having pelvic pain or abnormal bleeding, and what we're looking at there is uterus, ovaries, and cervix. Then there's small parts, which is considered the thyroid, scrotal, and breast ultrasound. And then last but not least is our venous, which is to rule out a blood clot in the veins. So what we're usually looking there is to rule out a blood clot in the lower legs or in the upper extremities.
Yeah, and outside of these 5 for general, you can also have MSK, which is musculoskeletal, which looks at tendons, looks for arthritis, tendinitis, all of those types of things, as well as pediatrics. Here at ProHealth, we do a limited amount of pediatric exams, but those are also options that you can get within the general track as well.
Great. So here at ProHealth, we, again, typically do 10 hours a day, and within that 10 hours, we scan about 13 patients a day, give or take. We see a vast range of patients from all different ages, all different conditions. We will scan a baby who is just a few hours old, and you might be scanning a patient who is in their last few days, months of life. We see patients who are in great health, and then we also see patients who are in poor health. So you kind of need to accommodate for the needs of the patient. Sometimes that's assisting the patient, just getting out of the bed or getting into the bed, dressing the patient because you might have to have them change. So just kind of keep in mind, everybody is at a different stage in life, and you were just, helping them along. All right, so kind of back to like what my favorite thing of being a sonographer, like I mentioned earlier, I was just always really interested in anatomy and physiology. That's a big thing of ultrasound since we are looking at all the organs in the body. I just seeing how all the organs work together was always really interesting to me. Ultrasound, you'll hear a lot is, you're just taking pictures. Well, it's a lot more than just taking pictures. You're helping the diagnosis. Sometimes I tell our students we're like little detectives for the radiologist. Without our images, we might not be able to get the diagnosis that the patient needs and deserves. So the radiologist really depends on you to get the images that you need. So you need to be very knowledgeable and competent in your job. It's a very big responsibility.
And ultrasound is a unique modality for the imaging and radiology world because we are often the very first, because we are not radiation involved. Providers will order an ultrasound before they go to a CT or X-ray or MRI, just because we are the least invasive. We're the quote unquote easiest for a patient to endure because, yes, we're one of the cheapest. So, that's one of my things, that we are the very first usually to touch a patient, and that can mean we are the first to see something and help that patient and be with them in their journey to getting better if there's something wrong, or being the first and only to then say everything's okay. Yeah. So it's a unique perspective ultrasound gets because we usually are the first person that they are seeing in the imaging world.
Then that kind of would segue into the least favorite part of your job. Just like Abigail mentioned, we are the first usually to be scanning a patient. A patient might come in with, oh, we found this lab was elevated and now I'm getting this ultrasound. Well, now I might have just found cancer on a patient, but I can't say anything because that's not my job. It's for a radiologist has to give results to the doctor. So unfortunately, we are not able to say anything at all. So we can be having conversations with this patient and then their life just changed. Same with, patients coming in just to check for pregnancy and, now they might have lost the baby, but we're not able to say anything. So that can be pretty hard, especially when the patient, could be nervous or excited, depending on whatever ultrasound they're getting. And then it's not the results that they're going to be hoping for or getting. So that can be a little challenging sometimes just because, we all want the best for our patients, but sometimes it's just not good news that is the outcome. All right, so other healthcare professionals that we work closely with, the main one is a radiologist. So a radiologist is a medical doctor who specializes in medical imaging. So after every ultrasound that we do, we write up a report and we send the images and the report off to the radiologist. The radiologist is the one who has the final say in our images, and they write up a report, and that report is then sent to the patient's doctor, and then that's how the patient gets their results. So we work with radiologists on a daily basis. Sometimes that's just a phone call, like they could call us or we could call them just asking a question, or, we work with them while doing procedures, or they come in and scan along with us. So radiologists are at the top. That's who we work with a lot day to day. Also doctors, ordering physicians, that's the doctor who ordered the ultrasound for the patient. We work with the ER doctors. We go down to the ER all the time when you're in the hospital setting. And, the doctor you come out of the patient's room and they could ask you, okay, what'd you see? Ask any questions. So you'll be seeing a lot of the ER doctors and surgeons. We actually go to surgery and do ultrasound-guided surgeries for the doctors. So they're performing the surgery, and then sometimes they just need ultrasound guidance so they can get a better view of where they're located. So you're one-on-one with the doctor in the OR. Then we work closely with nurses. That could be, nurses on the phone from the physician's office, nurses up on the floor with inpatients, or ER nurses. And then the last is biomed. They are medical engineers. They make sure our machines are running properly and functioning well. So we see biomed, every now and then. They come and check and make sure the machine is in tip-top shape.
And then the only other one I would add would be other imaging departments. So, that I feel like is kind of like a no-brainer, which is why it's not on here. But we do, you work very closely with the other imaging modalities and the other techs in the areas, especially if you're at a location that's only one sonographer. You're going to be interacting with x-ray techs and CT techs and all of that. So our radiology department, we always think of each other as just one big group. So we don't usually think of other people because they're just part of us.
That's it.